What's up, you guys? Hannah Rose here. So I know it's been a while since I've put out a video, but I've been kind of busy and I got put on call tonight. So I thought I would put out a video for you guys on nursing brains and what's important about them when you're looking for one, what I use, stuff like that. If this video is helpful, definitely hit that like and subscribe button and let's get into it. Okay, so why do you need to use a brain? For me, I'm one of those people that needs to write everything down in order to remember it. So that's what the brain is for, and that's why I use a brain. It's also easy when you go to give a report in the morning. You can just read right off of your brain, and after working a 12.5-hour shift, your actual brain might be a little hazy and mushy. So using the paper brain can ensure that you don't forget anything. And if the oncoming nurse asks you any questions, you can just look right down and you have your answers right there. And then they're properly set up for their shift. And it's just all around a better situation. Okay, I wanted to take a moment and do like a quick heads up, PSA, whatever you want to call it, because I have been guilty of this and I've seen nurses be guilty of this in the past. And so it's just important for me to mention it because the whole point of these videos is for me to help you based on things that I've experienced, things that I've seen, stuff like that. So when you're going to find a brain, I caution you when picking one that like looks pretty or you think will work. Find one that is good for your situation, has what you need on it for your floor, and also makes sense in your brain. Because I am guilty of finding one that's like, yeah, maybe this one will work, and then I'll try it out and I can't find where to put things, or, you know, I like need to add little sections in, and if you're adding stuff into your brain, it's not the right brain for you because it doesn't have what you need, obviously. So that's my little like heads up. If you are using one and it's not working for you and you still think it like looks pretty or whatever your reasoning, and I don't know what your reasoning is, but find a different brain because that one's not working. Okay, so before I show you my brain and we get into it, I wanted to show you what I use to write on my brain, and it is these wonderful erasable clicker gel pens. And the reason I use these is because I hate pencil, but I want to write in pen and I'm human, so I make mistakes. And I also work like 3 days in a row, so if I have the same patient back and things have changed, I can erase it and then write in there. Some of the other common things that nurses do is they use pen and they'll start over with a brand new brain the next day, or they'll just like scratch out and write above it. Or I've seen those, you know, clickable with different colors on the top. I'm sure you guys know what I'm talking about. So those are, you know, a couple things that I've seen nurses use, but these are my absolute favorite. I got them on Amazon. I will link them in the description. They're awesome. I highly recommend them. Okay, so here is my brain. So you'll see on the upper left-hand corner, there's kind of a blank space. This is where I put the patient's sticker, which normally includes patient name, date of birth, the day that they were admitted, and then their medical record number, which I like to have on there just to have general information about my patient readily available. And then if you move a little bit to the right, you see isolation, code, allergies. I also like to have this right at the top just because it's important information just to have right there. And then I have a very large box for diagnosis, and normally this is one word, why they're there. But I like to have their whole story. So they came into the ED with shortness of breath, and then they came up to us because of blah, 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 and then they got intubated on this date, extubated on this date, and now they're on 2 liters. So all of that I like to put in this box. So I like to have a lot of room, but that's just me. And then I have a pretty good amount for history because a lot of my patients that I get have a lot of history. So I try to keep it to pertinent stuff, but I do like to write a lot in this box as well. So I have a pretty big box here. Then you move down and I do it by systems. So I have neuro, and I tend to not write a ton in this area, so I have a little bit of smaller room here. Cardiac, I have a little bit of a bigger room because it's a pretty important system, so I like to write a little bit more. Respiratory, similar here. I like to have a lot of room here because a lot of stuff happens in your respiratory system. And then I have vent settings because a lot of my patients are on the vent because I work in the ICU. If you don't work in the ICU, this may not pertain to you. And then I have GIGU. I mix these because they tend to have similar crossover, so I like to have them in the same box, whether the patient has a Foley or not. And then I also mix skin and musculoskeletal because I tend to not write tons about each of those systems, but I do like to have a section, so I mix them. Then I have what lines the patient has, any drips they're on, and then the docs that are following them. And then if you move to the right, I have a little table with all the times, and I tend to write my meds that are due, any assessments that I have to do. If we're taking a field trip, I'll write it in here, stuff like that. And this paper gets folded in half, so I'll fold it in half, and this is technically we've moved on to the back of the paper. And then on the very bottom of the right side, you see the labs. And I'll write the labs when I first get in, and then I'll change them when we get the morning labs, like very close to the end of my shift, so that I can give the oncoming nurse the most recent labs. You will also see that there's a very large blank space on the very right of the piece of paper. I put a sticky note here, and I call this my current events section, and I write anything that happens during the night in this section, and then I can throw that sticky note away, and I can put a new sticky note if I get that and the patient back the next night. I just kind of like that system because I don't have to do a ton of erasing, even though I do have my erasable pens. So this is my brain. It may not work for you, but it works for me, so hopefully you get a couple tips and tricks from it.